So if you've ever been diagnosed with a disc bulge or herniation in the lumbar spine, you got the pain going down the legs, severe lower back pain, these are the exercises that we give our patients that get fantastic results. First exercise is lumbar rotation. So we're gonna do it in laying down position, supine. Reason why, if you have a disc related issue, this is probably the most comfortable one you're gonna be in. Your spine isn't loaded up, typically sitting flares up a disc, or any type of bending forward is gonna aggravate that disc and make the symptoms worse. So best offloaded position. Now we're gonna have you go ahead and bend your knees. Now, say there's a disc symptoms going down, say, Haley's left leg. We're wanting your legs to go toward the direction. So she's going to move her feet a little bit over to this side, okay? And then so you're kind of collapsing this area on the side. So typically when they walk in, you're kind of like hunched over a little bit because you got the disc bulge and you're trying to take pressure off of it. We're trying to close that gap there, okay? Because when you have a disc bulge, it's bulging out to that side. We're trying to close that gap down. Now what we're gonna have her do, keep your feet there. Now you're going to rotate toward the side, very gently, okay? And she's gonna come back out of it. Rotate again, good. Now I'm gonna have, just to kind of add extra support, she's gonna have her arms out to the side, like a T position. And then she's going to let it rotate only to the side where she has the symptoms down. In this example would be her left leg. Now say it hurts. She's gonna come out of it just a little bit. Then I want her to take a nice deep breath. We like to do what they call box breathing. You breathe in the nose for 5, hold for 5, out for 5, with blowing, like you're blowing out a candle through your lips, hold for 5, and then relax and breathe in again. So I want you to do 5 breath cycles of the 5 breath box breathing, okay? So she can come out of it a little bit, then go back again. Now what you're doing here is you should have a good 90 degrees here, and you should have ankle to ankle, okay? This should be a nice, comfortable position. This should not increase anything. This should be almost like you're doing nothing. But if you have that symptoms of pain, you are going to enjoy this one because it's taking the pain away from that disc irritation. Number 2, this one's the classic, McKenzie prone press up. So what you're gonna do first, sometimes just laying on your belly is hard enough. So what we try to do is have you take those nice deep breaths in with you, just in a slightly extended position, okay? I'll have them take maybe 2 or 3 breaths, then I'll have you first go up to your elbows. So just kind of hold and prop yourself up on your elbow. Good. Okay, same thing. This might be all you got. I'm okay with this. This should be a progression. Now, I don't want you to really hold this position for too long. That's why I like breathing. She's gonna come up, she's gonna hold her breath, do the nice deep breathing, and then whenever she breathes out, she's gonna relax back to the ground. Then nice deep breath up again, press up, good. Deep breath out, in, then out when she goes down. This should be a pumping mechanism. So she's opening up her chest here, air should come in, you breathe in, then she's collapsing back down, air is going out, she's breathing out. Now, she's having most of the movement happen in her arms. She's not using her spine to pull her up. This should be a passive movement in the back, okay? So I also don't want you like squeezing your butt really hard for this one because it should only be a passive movement in the arms. So try it again, lightly press up, take your time, good. And then breathe out, relax back down. We'll chart 5 breaths. Then we're gonna cycle to something that's a little harder. Now she's going to use only her arms to press all the way up. So go ahead and do the full press up. Good. See how her hips are not coming off of the ground? That's good, okay? Then let it all out, breathe out. Good. So breathe in, press up. Good. Breathe out. 5 breaths for this one. Sometimes it kind of hurts a little bit through here. What I have you do is widen out your hands a little bit, and then I want you to start the movement here. So I always have the patients look up first, and then press up, and then extend if you can here. And that kind of is what they call a uniform spinal curve. And then so when she relaxes back down, relax here first, and then tuck the chin. Then she's gonna start the movement with the head, look up, extension here, extend here, extend here. So it takes some of that hinging pressure off of just the lumbar spine. Number 3, this is a wall slide or glide is what we call it. Another McKenzie. This is another golden one. Got the symptoms going down the left leg, okay? Your opposite shoulder is going to be on the wall, okay? Now the tendency is to want to have the elbow kind of tucked to your side. I want it to kind of come out about a good 45 degrees. Next step is to move your feet about 1.5 to 2 feet away from the wall. So you're leaning onto the wall. Now these are for those people who are kind of coming in like this, leaning, because their body naturally doesn't want to have pressure over that pelvis and on that disc. So now we're going to try to sit there and see if we can straighten that bad boy out. You're gonna have your hand on the hip. This is not there to push your pelvis into, it's just as a guide. You're taking it nice and slow. What she's gonna do now is to drop her hip to the wall. Go ahead and deep breath. Come on back out of it. Good. Sometimes just going a little bit hurts. Stop. Back out of it just 1/4 inch. Take a nice deep breath. Relax. See if you can go a little bit further. If that still hurts, back out just a hair. Nice deep breath and relax. This should not cause pain, but if it does, come out of it. You're trying to allow that body to not go into spasm mode every time you shift the body into a correct position. So there again, breathe is our thing. Instead of time and reps, I want you to think of breaths. Take your time, 5 reps. So if these exercises help you with your back issue, man, hit the subscribe button. We try to get more content just like this. And hey, it's time to take ownership of your health and wellness.